Welcome to the Housing Stabilization Services Remote Regional Roadshow for Counties and Tribes. My name is Jensina Rosen, Housing Policy Consultant with the Minnesota Department of Human Services, Housing and Support Services Division. Thank you for making time to watch this roadshow. This PowerPoint was initially provided to county and tribal partners via 5 remote regional roadshows offered across the state. This recording occurred outside of the live roadshows. Today, we will be going over the following agenda items: a high-level overview of housing stabilization services, the role of county or tribal assessors and case managers, provider training updates, the individual enrollment process through our eligibility request form, working with managed care organizations, the impact to housing support, and some important reminders and additional resources. In addition to myself, Becca Koffenberg-Satry and Mark Caldwell with the Housing Stabilization Services team will also present roadshow material. I will now turn it over to Mark to provide a high-level overview of Housing Stabilization Services.
Thanks, Jensina. Yeah, this is Mark Caldwell, and hopefully by now you've all heard about the new Medicaid Housing Stabilization Service benefit that launched on July 20th of 2020. We're excited to be able to address the health of our Medicaid recipients by offering this service to stabilize people's housing. For this presentation, we will be covering a high-level overview of the services with more detail on the county and tribal role in the services. For more details on the services, please check out our policy webpage, which has detailed policy information and a PowerPoint for December 2019 that goes into more specifics about the services. So some important news. Housing Stabilization Services are now available for individual enrollment as of July 20th, 2020. Due to the impacts of COVID-19 on the Housing Stabilization Services Eligibility Review System development, claims and billing start date is expected to be August 24th of 2020. Equally important is to know that this is a rolling implementation. If providers need time to make an informed decision as to enroll, that is completely okay. There's no deadline for enrollment. So the goals of these services are to support an individual's transition to housing, increase long-term stability in housing, and avoid future periods of homelessness or institutionalization. The 2 primary services in Housing Stabilization Services are transition, which helps people plan for, find, and move into housing, and sustaining, which supports a person to maintain living in their home. These services are not sequential. A person doesn't need to have used transition services to access sustaining services. If a person first needs supports to maintain their current housing, they can access sustaining services right away. There's also a third component, housing consultation. Housing consultation is a new planning service available through Housing Stabilization Services that provides a person-centered plan for people without Medicaid-funded case management. To be eligible for the service, an individual needs to be a medical assistance recipient and aged 18 or older. Beyond this, there are 3 basic eligibility criteria: disability or disabling condition, housing instability, and need for services due to limitations caused by the individual's disability. This should look familiar to you, and we'll go into more detail in the next few slides. Housing Stabilization Services uses the expanded definition of disabling condition as established by the Department of Human Services Housing Support Guidelines. A person does not need to be certified disabled in order to access these services. So, disability and disabling condition include aged, blind, or disabled as described under Title II of the Social Security Act, people determined by a medical professional to have any of the following conditions: long-term injury or illness, mental illness, developmental disability, learning disability, and substance use disorders. In order to provide proof of disability, there are a number of criteria you could use. You could use the Professional Statement of Need, and note that in June 2020, the Department of Human Services released an updated Professional Statement of Need. The professional statement of need now includes eligibility criteria for housing stabilization services. County designees cannot complete the professional statement of need for housing stabilization purposes. Additionally, other proofs of disability include a medical opinion form, a proof of receipt of SSI or SSDI, and other forms of disability documentation to be determined. An individual or family is considered homeless when they lack a fixed, adequate nighttime residence, and therefore Minnesota meets Minnesota's definition for homelessness, as well as someone who is at risk of homelessness. At risk of homelessness includes when a person would likely become homeless or their housing would be at risk without housing sustaining services. This is important to remember when a person is housed, due for an eligibility reassessment, and continues to need housing sustaining services. Additionally, someone could be transitioning or have recently transitioned from an institution or licensed or registered setting, or they could be eligible for waiver services. Housing instability can be documented by a professional statement of need, MnCHOICES assessment or long-term care consultation for persons with a need for long-term services and supports, or a coordinated entry assessment for persons experiencing homelessness. In addition to having a disabling condition and housing instability, a person must be assessed to need assistance due to their disability in one of the following areas: communication, mobility, decision-making, and managing challenging behaviors. An assessed need will be captured in each of the three pathways. It is important to note that the professional statement of need is the primary pathway onto the services because it captures all three needs-based criteria: disability, housing instability, and assessed need for services. In addition to the professional statement of need, someone could also have a MnCHOICES assessment or long-term care consultation, again for persons with need for long-term services and supports, or a coordinated entry assessment for persons experiencing homelessness as a way to also show housing instability. Housing stabilization services are home and community-based services and must meet all CMS and home and community-based requirements. One of these requirements is that a person must have a person-centered plan. Everyone receiving housing stabilization services will be required to have a person-centered plan. The person-centered planning process must be driven by the individual, include the person's strengths, interests, wants, as well as what supports they need, and help the person make an informed choice about their housing stabilization service provider. The responsibility of the person-centered plan depends on if other professionals are involved in the person's life. We will go over what this looks like specifically for county and tribal workers who may be responsible for connecting people to housing stabilization services. Who does the person-centered plan? If a person already has MA-funded waiver case manager, that person will complete or update the coordinated services and supports plan or the coordinated care plan to include housing stabilization. If a person has a targeted case manager, the targeted case manager completes a housing-focused person-centered plan. If a person does not have a targeted case manager or MA-funded case manager, then the person needs to find an enrolled housing consultant in the area to complete this requirement. We've recently published the Housing-Focused Person-Centered Plan, and it is available for viewing through the Department of Human Services eDocs page. In summary, this is a visual of the process an eligible person takes to enroll in housing stabilization services, from assessment to eligibility review. In the box starting at the top, you will see assessment for a professional statement of need, MnCHOICES long-term care consultation, coordinated entry, and then assessment. The second box indicates plan. This could be a housing-focused person-centered plan for either a housing consultant or targeted case manager, a coordinated services and supports plan if someone has a waiver case manager, or a coordinated care plan if someone has a senior care coordinator. The third box indicates that any housing stabilization service provider is the one who submits the documentation, and they will submit the assessment, the plan, and documentation of disability and disabling condition. The fourth box indicates that in the eligibility review, a provider will be notified through minutes that they can begin working with that person. The next portion of our presentation will focus on the MnCHOICES Assessor and Case Manager's role. I will now turn it over to Becca, who will walk us through the role of MnCHOICES Assessors.
Thanks, Mark. This is Becca Koffenberg-Satry, and I am going to talk through the MnCHOICES Assessor portion. First to note is that the MnCHOICES Assessor and Waiver Case Manager roles, the key thing to know is that assessment and planning for Housing Stabilization Services is primarily the same as the current processes MnCHOICES Assessors and Waiver Case Managers use for waivered services. It is important to know as we move on to describe these processes in detail. So the MnCHOICES Assessor role. The MnCHOICES Assessor role in Housing Stabilization Service. Assessors play an important role in helping people access housing stabilization services. They document the need in the assessment, identify the needs for housing services, capture the need on the Community Support Plan worksheet, and complete referral for housing consultation when there is no case manager with that responsibility. The role of the MnCHOICES Assessor, assessment. The current MnCHOICES assessment can be used to identify the need for housing stabilization services. Through the current assessment interview, assessors identify areas of need for which the person requires assistance. A person who has challenges in one or more of the following 4 areas meets the needs-based criteria for housing stabilization services. So when they need support in communication, mobility, managing behaviors, and/or making decisions. The other area of need is housing instability. While the assessor is completing the housing section, they should identify if the person is homeless, at risk of homelessness, including could become homeless without continued housing services, institutionalized, currently or within the last 6 months, or eligible for a waiver. A person with an institutional level of care is also deemed at risk of institutionalization. Through the assessment, if they see a person meets any of these housing instability categories, the person has met this needs-based criteria. Document the need in the housing environment domain. So in the housing and environment domain, this box says current rental is being sold and they are required to move. Casa's mother has been trying to locate housing. She reports that they might be discriminated against because after she meets with the landlord, tours the home, she is turned down. Under Identify Person or Agencies Assisting Individual, if needed, make appropriate referrals. It is written, they have been trying to relocate on their home, needs assistance to assure affordable options are found and to manage potential of discrimination. Describe concerns, barriers, and issues with effort progress. Indicate how concerns will be addressed. Concerned, they will not locate housing in time and will be evicted to the street. Worried about discrimination. And under the informed choice decision, it's marked yes, relocation goal with assistance is needed preferred, create new housing goal in plan. So again, when you're documenting the need in the housing and environment domain, the assessor documents the concerns and needs presented by the person or others in the interview, including collateral information received from providers as part of the assessment event. The assessor identifies what is needed for moving forward to address the needs by selecting the appropriate response option in the informed choice area. If the person needs to find stable housing, select yes, relocation goal with assistance is needed preferred, create new or retain housing goal and plan. When the person needs assistance with addressing current housing issues, sustaining current housing, select no, not seeking alternative housing, and ensure a housing goal is created highlighting areas of need to be addressed. So you summarize what you have learned are the important needs and preferences associated with the person's current housing or need to move, select the most accurate informed choice decision with regards to moving forward with the housing-related goal. If the person needs to find stable housing, select a response that best aligns with that goal, and if a person needs assistance to sustain current living environment, select a response that best sustains with that goal. In addition to documenting the areas of need within the housing interview narrative areas, the assessor creates a summary of the support planning implications for meeting the person's identified needs in the referral and goals panel. This slide, it says, CASA has needs in decision-making, mobility, and supported communication that affect her ability to independently secure needed alternative housing. She and her mother are required to move from current rental due to the sale of the property. Explore housing supports to assist with finding affordable housing that meets their needs. As a reminder, this narrative prints to the person's eligibility summary and is available in the MnCHOICES support planning application. Because Housing Stabilization Services are not waiver paid services, the assessor also uses the referrals needed area to document the intended referral to Housing Stabilization Resources. You can see that the highlighted line states Housing Stabilization Consultant Services. Housing and Environment Referrals and Goals. Within the Referrals and Goals group, the assessor completes the following: narrative summary, support planning implications, that prints to both the assessment eligibility summary as well as the community support plan summary of needs. Then the document needed referrals in the referrals needed prints that list, that prints to the community support plan recommended referral section. At each assessment, the assessor completes the CSP worksheet, the 6791A EDOC number, a duplicate legal size form, and gives the top copy to the person before leaving. The carbon copy is retained by the assessor. Within the supports for me to consider area, housing support options have been added to allow the assessor to indicate on the form the person's identified need and preferences to be referred to housing stabilization supports. The highlighted text reads, housing support, stay, move, so you select one and circle the relevant option. And with the ability to check the support concerns, the criteria associated with behavioral, communication, decision-making, or mobility supports, then there is also the ability to identify the service's eligibility risk factors for homelessness, at risk of homelessness or transitioning from an institutional setting. When the person does not have a waiver, targeted case manager, or VADD case manager, senior care coordinator, the assessor is responsible to assist the person in connecting to a housing consultant through the Minnesota Healthcare Programs Provider Directory. To do that, they will search for home and community-based services with subtype Housing Stabilization Services. They will complete with the person any needed releases of information and inform the person of the need to retain their copy of the Community Support Plan worksheet to provide to the housing consultant. Best practice for people without a case manager is to help that person create a vault in HB 101 and upload the CSP into the vault. Also, support the person in contacting their chosen housing consultant to help ensure service access. When you consider that the person you've assessed has a disability and is experiencing housing instability, it is understandable that it may be challenging for them to contact a housing consultant themselves and retain the documentation that the consultant will need. With your help in practicing these best practices, will most help make sure that that person gets connected with the housing consultant and can move on to the services. Next, we will move on to the role of the waiver case manager, and Jensina will walk us through it.
Thanks, Becca. As Becca said, we will now be moving on to the role of the waiver case manager. A waiver case manager's role in the Housing Stabilization Services process is very similar to when a person needs a waiver service. The waiver case manager will begin the process of helping a person move by ensuring that their request for housing stabilization services has been documented in the Coordinated Services and Support Plan, or CSSP. If the request occurred at the assessment or reassessment, the need must also be documented in the assessment and community support plan. The waiver case manager will support the person to choose a transition or sustaining provider to provide housing stabilization services and complete the service section to include housing stabilization services in the CSSP under the Other Agreements tab. Waiver case managers will securely email or mail the completed CSSP to the chosen provider and request the provider's signature. The Housing Stabilization Services provider uploads the information from the CSSP into the DHS Eligibility Review System. The waiver case manager will ensure housing stabilization services are coordinated with the rest of the person's services and monitor the person's progress with the Housing Stabilization Services provider and communicate with other supports as needed. Finally, the waiver case manager will complete the My Move plan summary once the person has identified a place to move. So where in the community support plan can a case manager identify a need for housing stabilization services? The case manager can identify the person's preferences and need for housing and housing stabilization services in many different places throughout the CSP. There are no specific spots generally, but information may be found in the following sections: general plan notes, what's important to the individual in the quality of life domain, safety and self-preservation domain, or the housing and environment domain. May also be located in the short and long-term goal sections, the action steps for goals, summary of needs, recommended referrals, and anywhere else in the CSP. So where in the CSSP can a case manager document the need for housing stabilization services? Some suggested locations include general plan notes, short and long-term goals, action steps for goals, summary of programs and services, and really anywhere else in the CSSP. The need for housing stabilization services does not have to be documented in all of the above spots. Those listed above are the most appropriate spots to identify the need for housing stabilization services. Where can case managers document the need for housing stabilization services? This slide demonstrates a few examples of how the need for housing stabilization services can be documented in the CSSP. The top section or example is in the general plan notes and reads, Delford is ready to move into a bigger place of his own. He would like to live in a quiet area with neighbors that respect his sobriety. He does not like to use public transportation, so it is important for him to live within walking distance of his church and sister. This will also give an opportunity to utilize grocery delivery options. Over the last year, Delford decided to focus in finding employment instead of the expungement process. This is something he needs to work on so that he can move where he wants. Another example is in the short and long-term goals section. Here, under goal statements, the need is identified as shown in the red circled area that says Delford will work with his housing stabilization services provider on the expungement process and to find a home in a safe neighborhood. Another example includes the action steps for goals. Under what will the person do, and circled in red on the screen, is Delford will complete and submit his expungement paperwork with the help of his housing stabilization services provider. And under action steps for goals, what will the case manager do? It reads, Delford's CADI case manager will continue to connect with him as needed to review progress towards goals. The case manager will refer Delford to his chosen housing stabilization services provider and communicate Delford's plan and preference with the provider. His case manager will complete the My Move plan summary with Delford once Delford identifies his future home in order to help with the transition. Delford's case manager will connect with providers as needed for regular monitoring of Delford's progress. This slide shows a screenshot of the support plan application and provides an example of service documentation within it. Here, in the support plan application, the Services tab is circled and highlighted, as well as the Other Agreement section. This is where housing stabilization will be entered into because, as Becca explained earlier, housing stabilization is not a waiver service and so does not go on a service agreement. It goes into the other agreement section under the Services tab. This slide shows examples of service documentation in the CSSP document. The areas of need should always be listed in the areas of need section of the CSSP document. So at least one of those 4 needs-based criteria need to be identified in the areas of need section. So we should be able to see mobility, communication, managing moods or behaviors, or making decisions. When completing the CSSP, please remember to use person-centered language. This includes using person-first language, using the word person or the person's name rather than client, individual, or consumer. Identify what the person wants or needs to move, for example, finding a place, expungement, or actual moving, and identifying what each support or service is responsible for and any relevant timelines. Here are a few other reminders for waiver case managers. Discuss with the person how they want each support or service involved in planning and decision-making. A reminder to case note conversations with the person and the team, and be sure to update the coordinated services and support plan with any new housing information, significant changes as a result of moving, and request and document signatures from the person, their legal representative if applicable, and other service providers. Remember to contact and involve informal supports as the person requests, and a new training is available for waiver case managers in TrainLink under Supporting My Move, a Case Manager's Role. Housing Stabilization Services Renewal. The assessment and plan must be updated annually as with other home and community-based services. Reassessment is the same process as initial eligibility, so a MnCHOICES assessment and CSSP update. Now we will move on to the role of targeted case managers, which will be covered by Mark.
Thanks, Jessina. So please note this is a very high-level overview. Specific targeted case manager trainings were provided in June of 2020 with much greater detail. If you missed those trainings, we'll be posting them soon on our website for you to review. We've broken down the role of the targeted case manager in Housing Stabilization Services into 4 parts: identifying need for service, documenting eligibility for housing stabilization services, person-centered planning, and coordinating housing stabilization services with other services. Documenting eligibility, the role of the targeted case manager. The targeted case manager may complete and sign the professional statement of need if they meet the professional qualifications, so you should support them to get one signed if you do not. You should also assist the person in obtaining the required documents such as MnCHOICES assessment, coordinated entry assessment, and proof of disability. The most important thing to note is that if you meet the qualifications to complete a professional statement of need, you can sign this to provide documentation of eligibility criteria for the person. As we discussed earlier, the professional statement of need is the primary pathway onto the services because it assesses for all needs-based criteria. If you do not meet the qualifications, you can still help by assisting your client in obtaining the required documents. Targeted case management and person-centered planning. Housing Stabilization Services are state plan, home and community-based services. They must meet all HCBS federal requirements. One requirement is that everyone has a person-centered service plan. Targeted case managers' role is to plan for and support people to access needed services, which is why they are required to do the housing-focused, person-centered plan for housing stabilization services. The plan helps the person they are serving access the needed service. Once the person has assessed need and proof of disability, they need to have a person-centered plan completed that meets very specific person-centered plan federal requirements. For anyone with a targeted case manager, the targeted case manager must complete this plan. The plan is called a housing-focused person-centered plan. This plan was designed to be simple and short and meet home and community-based service requirements. You can find it as EDOC 7307 and search the eDocs directory to find it. So why do we need to do a different plan? You might be wondering why. Because home and community-based person-centered plans must meet very specific requirements. Current plans completed by targeted case managers do not meet the HCBS requirements, and the newly developed housing-focused person-centered plan does. The housing-focused person-centered plan focuses primarily on housing-related goals, needs, strengths, and supports. What do I do with the plan once it's complete? First, select a provider. Work with the person to identify a housing, transition, or sustaining provider. Second, submit a form. Submit copy of person-centered plan and any documentation to the provider who will upload it into the Housing Stabilization Services Eligibility Review System. Third, obtain a signature. Ensure provider returns a signed copy of the plan. Once you've completed the form, you will need to get it to the person's selected transition or sustaining provider who must sign it and return it to you. Updating the plan. These plans must be done every year. You should also update the plan if the person requests it, if they have a major change in their housing situation, or if they change providers, such as they want to change their housing transition or sustaining provider. Coordinating stabilization services with other services. You should provide referrals to other services that will support housing, help all service providers to work together, monitor progress and effectiveness of services, ensure there is no duplication of services. If a person has a waiver case manager, they will complete a MnCHOICES and coordinated support and services plan. If a person has a senior care coordinator, they will complete the LTCC and coordinated care plan for seniors. If a person has both waiver case manager, senior care coordinator, and targeted case manager, the waiver case manager or senior care coordinator completes the assessment and plan. Both waiver case manager and senior care coordinator, then the waiver case manager would complete the assessment and plan for that person. Now I will turn it over to Jensina, who will discuss training updates.
Thanks, Mark. I will just be covering a couple of slides with regards to provider training updates. The training for housing consultants and transition sustaining providers is now available on TrainLink. The training is located in the Housing and Support Services Learning Center. In order to complete the training, every staff member will need a unique key that is generated through TrainLink. It is free and easy to get. Staff will need to go through all of the training modules in order to get a certificate of completion. This may take 2 to 3 sessions to complete. Once staff have completed the training, certificates will need to be held by the organization for monitoring purposes by DHS. Note that employees can access certificates from the Learning Center. If they move to a new employer, they won't need to retake the training. Enrolling people in Housing Stabilization Services occurs through the Housing Stabilization Eligibility Request Form, or DHS 7948. In order to provide housing stabilization services and receive it, a person must first be found eligible for the program. The form is available through the DHS eDocs library, and it is an interactive eDoc, which once submitted is automatically sent to eligibility review staff. Once you've entered the form, you will need to submit a reason for your request. Mark will go over what it looks like to submit an initial eligibility request form for people served, and I'll hand it over to Mark now.
Thanks, Jensina. So, enrolling people in housing stabilization services. In order to provide housing stabilization services, a person must be first found eligible for the program. Eligibility documents are uploaded into the Housing Stabilization Eligibility Request Form. This form is an interactive document which, once submitted, is automatically sent to the eligibility review staff. You can visit the eDocs library to search for this form. Once you've entered the form, you'll need to submit a reason for your request. So there are 6 different reasons a provider can submit an eligibility request form. We're going to go over the initial eligibility request together and then provide a brief description of other types of forms. On the right, there are 5 different boxes that we will go through. Starting at the top is recipient information, consultant, housing provider, attachments, and submitter. Housing Stabilization Services recipient information. The recipient information section requires housing status, housing instability, disability type, PMI number, person master index, date of birth, living situation, and address, which is city, state, zip, and county or tribal location. Next, we'll move on to the consultant box. If you're the housing consultant, you will click yes. If a plan was developed by a waiver or targeted case manager or care coordinator, you will click no. If you click yes, you'll need to provide this additional information: agency name, NPI, UMPI, contact first and last name, zip code, county or tribal location, phone number, and email address. If you're a housing consultant, for housing provider, you will need to input the transition and sustaining provider's information as listed in the Housing Focused Person-Centered Plan. The Housing Transition Sustaining Provider Information section requires name, city, zip code, and county or tribal location, as well as the contact phone number. The Attachments section requires that you submit supporting eligibility documentation. The 3 areas you need to submit attachment documents are proof of disability, assessment type, and person-centered plan type. Only the PDF, Word, Excel, JPEG, GIF, PNG, bitmap, and text files may be uploaded as attachments. Make sure you've looked over all of the documents you want to attach to verify they're accurate and up to date. So here is a list of all documents you could attach to show someone's proof of disability: professional statement of need, state medical review team, MADX or MABX, and in this case, you do not need to attach anything if you select this option because DHS eligibility review staff will check this in the review process. Additionally, you could submit Social Security income or Social Security disability insurance. For proof of disability for SSI and SSDI, you could include a check stub or deposit verification, and in this case, the date must be within 90 days of form submission, an award letter, or the benefits lookup worksheet from HB 101 or DB 101. Additional proof of disability could also be a medical opinion form or age over 65 or over. Now here's a list of the assessment types you could attach to show someone's proof of housing instability and assessed need. Professional statement of need, which also meets proof of disability, coordinated entry, a MnCHOICES assessment or long-term care consultation. And if you're a housing consultant and you select this option, you'll submit the Community Support Plan Worksheet, which is DHS 6791A. If a person has a waiver case manager and you select this option, you won't need to submit an attachment. There are 2 options to choose from for the person-centered plan type. Housing focused. This will be selected if you're a housing consultant or if someone has a targeted case manager. Coordinated service and supports plan. You will select this if someone has a waiver case manager or senior care coordinator. Important to note, If someone has a senior care coordinator, when asked for the attachment, you will submit a coordinated care plan under the Coordinated Services and Support Plan option. The look of this plan may vary based on what type of health plan the person has. And lastly, the submitter information section requires that you submit the first and last name and then click Submit. An eligibility request form will be processed as soon as possible in the order it is received. So DHS staff will review documents and then notify the provider if the person's application has been approved or denied. If denied, a notification will be sent to providers and the person with comments as to why the request was denied. Approval notifications will be sent via the Minutes mailbox to providers and to a person through the mail. If a person has been approved, providers may begin working with them and start billing for service. In addition to the initial eligibility request form, the online system includes 5 additional forms that may be submitted. Renewal eligibility request. Submit this type of request when a person needs to have their services renewed, which occurs on an annual basis. Providers will submit the same information and attachments as the initial eligibility request. A PC plan request. Submit this request when a person has their person-centered plan updated. Providers will submit the same information as the initial eligibility, except only attach the updated person-centered plan. Provider change request. Submit this request when a person selects a new provider. Providers will submit the same information as the initial eligibility, except only attach the updated person-centered plan with the new provider listed and signed. Additionally, you could submit an additional transition or additional sustaining unit request. Submit this request when a person will need an additional 150 hours of transition or sustaining services. Providers will submit the same information as the initial eligibility, except only attach the supporting documentation for the exception request. Examples include, but are not limited to, eviction notices, criminal records, past due bill statements, or written complaints from landlords. I will now hand it back over to Becca, who will talk a little bit more about managed care organizations, or MCOs.
Thanks, Mark. I'm just going to give a very high-level overview of MCO information. Much of this section is information and links to resources where further information can be found. Most people eligible for Minnesota healthcare programs are enrolled in managed care. We anticipate that 80% of people served on Housing Stabilization Services will have an MCO. DHS currently contracts with these 8 managed care organizations: Blue Plus, Health Partners, Hennepin Health, Itasca Medical Care, Medica, Prime West, South Country Alliance, and UCare. MCOs have contracts with DHS to provide healthcare services to 3 specific populations: families and children, sometimes known as PMAP, covers parents and caretakers of dependent children, pregnant women, low-income adults without a dependent child. Minnesota Senior Health Options, MCHO, or Minnesota Senior Care Plus, sometimes called MSC Plus, provides services to clients age 65 and over who have medical assistance and Medicare Part A and B. The third one is the Special Needs Basic Care. This is a voluntary managed care program that covers health care for people with disabilities who are age 18 through 64, have medical assistance, and Medicare Parts A and B. For providers to enroll with MCOs for Housing Stabilization Services, providers must first enroll with Minnesota Healthcare Programs through the Department of Human Services, then contact each MCO to complete any paperwork required to enroll in Housing Stabilization Services with that particular MCO. Then they will bill each person's own MCO for services, And it's important that providers check each month to ensure the person has the same MCO, because people can change MCOs. If they do not have the same MCO as they were billing last month, they should contact the new MCO and give the information that they will now be providing services for one of their members. The following 3 slides provide resources to help counties and tribes connect with MCOs in their areas. These are the links for the 7 MCOs that require paperwork for Housing Stabilization Services. As of this writing, all MCOs have agreed to use the DHS network of enrolled Housing Stabilization Service providers. In order to work with an MCO, providers will need to complete enrollment paperwork with the MCOs in the area. Some MCOs require minimal paperwork, such as a 1- to 2-page agreement, in order to enroll and bill them for services. So these are the links. The next slide. In this page and the following page, identify each MCO and the specific person to contact of that MCO who is responsible for Housing Stabilization Services. This final page of the MCO section is resources and contacts. So there's the link to the MCO Customer Member Service Information webpage. There's a link to the provider portal, a link to the provider registration, and the contact for Mike Flicker, who is DHS's MCO contract manager for Housing Stabilization Services, and he's very happy to answer any questions you may have. I will now turn it over to Jensina, who will talk about the impact of housing stabilization has on housing support.
Thanks, Becca. I will just be providing a brief overview to the impact to the Housing Support Program. Of course, if you have further questions about the Housing Support Program, please feel free to reach out to the Housing Support team directly. In 2017, the Minnesota legislature authorized the Department of Human Services to pursue MA Housing Stabilization Services. Through this legislation, it was determined that 50% of the supplemental services that are typically offered through the supplemental service rate are duplicative of housing stabilization services for people in community-based settings. As a result, there is a scheduled reduction of 50% in the supplemental service rate scheduled for July of 2021 for these categories only: long-term homeless supportive housing, the Metro Demo Project, and housing with services independent living, not assisted living. The reduction is not dependent on provider enrollment in housing stabilization services. So the reduction in these 3 categories of housing support providers in the supplemental service rate will occur whether or not you enroll in housing stabilization services. This slide shows a section of the new professional statement of need. And in the professional statement of need, there are 4 different supplemental service areas that would be identified when completed as what the person would require assistance with. So tenancy supports, supportive services, employment supports, and health supervision services. Tenancy supports clearly overlaps with housing stabilization services, and the support services option could be duplicative based upon what services are provided. Housing support does pay for some services that housing stabilization services does not, including the employment supports and the health supervision services. So this is where the 50% supplemental service rate reduction came from. Things that won't change for housing support. The room and board rates will not change for housing support, and providers will continue to bill in minutes for supplemental services. Providers will continue to meet the service standards related to the professional statement of need, and documentation remains required. This includes case notes, and it is okay to track the housing support supplemental services as well as the housing stabilization services in the same system, so long as activities can be reported separately And there is no electronic health record requirement, which should be noted is also not required for housing stabilization services. So what should housing support providers do over this period of time before the rates are reduced? The first is to identify which housing stabilization services is a good fit for your agency to provide, and then enroll to become a housing stabilization services provider. Use the time to develop processes before rates change and develop partnerships for assessments, person-centered plans, and billing. Finally, please reach out to the housing support team or to the Housing Stabilization Services team for technical assistance if needed. I will now turn it back over to Becca, who will cover some important reminders about housing stabilization services, additional resources, and planning tips before we end the presentation.
Thanks, Jensina. So the last section of important reminders and additional resources. Housing Stabilization Services and other services. Housing Stabilization Services duplicates Housing Access Coordination in the 1915C waivers. These will be removed from waivers and people will access them through the State Plan Housing Stabilization Services. People will transition on to Housing Stabilization Services at their annual renewal with their waiver case manager. People will not be allowed to receive Housing Stabilization Services and the following services at the same time: Relocation Service Coordination, Assertive Community Treatment, and Moving Home Minnesota. These services are okay to be receiving at the same time as Housing Stabilization Services. Housing Stabilization Services will not duplicate these services. If more intensive housing-related services are needed, clients receiving these services should be referred to Housing Stabilization Services. A person can receive these services and the new benefit: ARMS, Targeted Case Management with the exception of housing consultation; 1915C Waivered Services with the exception of housing consultation; Semi-Independent Living Services, Behavioral Health Home Services, or Healthcare Coordination through Substance Use Disorder Reform Services or CCBHC. In relation to housing-related grant programs, adults who are in grant-funded programs and eligible for housing stabilization should be referred to the new service, but may continue to also receive grant-funded services if those services fall outside of those covered by housing stabilization. For example, support with CD recovery. One of the requirements of home and community-based services is that the assessment and planning must be independent and free from conflict of service provision. This means that the assessment and the housing focus plan may be the same provider, but the provider agency that created the assessment or the housing focus plan cannot do the housing transition and sustaining service for the same person. We know that this is a source of frustration for many. However, it is an important federal requirement for these services. Note that providers can always be enrolled to provide both housing consultation and housing transition sustaining services, and we encourage providers to enroll in both to ensure access of services across the state. You just cannot provide them to the same person if you do not have an exception in place. So the home and community-based services conflict of interest requirement exception. A conflict of interest exception is required for a provider agency to do the assessment plan and transition sustaining services for the same person. The conflict of interest exceptions are for provider shortage areas by geographic area or cultural language specific providers. To access the exception, providers will submit an exception request to DHS to determine if they can waive the conflict of interest. It is important to note that right now, there is a renewed federal public health emergency with regard to COVID-19. This public health emergency allows this conflict of interest to be waived. Public health emergency must be reviewed every 90 days. So now the federal public health emergency is scheduled to end on 10/25/2020. Important billing notes. All counties enrolled housing stabilization providers must enroll as a provider type 18, not provider type 45. Billing will not occur through SSIS for housing stabilization services. All fee-for-service billing for housing stabilization services will go through the minute system. All the rest of it will go through the person's particular MCO, and tribes will not bill through an encounter rate for housing stabilization services. Now on to planning tips and resources. Think outside the box with these services. Think creatively. Some ideas include combining the new service with Minnesota Supplemental Aid or MSA housing assistance. MSA increased in July of this year to $392, and eligibility expands to people on or eligible for SSI, SSDI who are relocating to the community from a housing support setting. You can find information on this at DHS Bulletin number 204804. Also think about how we can pair the new service with housing supports. Strategically plan and deliver services. Considering ways to maximize housing stabilization services and integrate it into your community. Consider, as a county or tribe, becoming a housing consultation service provider for people not receiving MA-funded case management. This creates more access to services and frees up community-based providers to offer housing transition sustaining services and eliminates the conflict of interest for them. Consider ways housing stabilization services can help fund parts of the coordinated entry system, specifically through housing transition services to help people move. Think about how housing stabilization services can cover services paid for through state grant dollars and how to target these dollars towards services not covered by medical assistance. And this slide shows additional resources. So on DHS website, there's Housing Stabilization Services policy page. So you can sign up for a mailing list to receive important announcements. MHCP Provider Manual, the MHCP Provider Directory, and then, as we said before, here you search under Home and Community-Based Services with subtype Housing Stabilization Services to find enrolled providers. Frequently asked questions. This has a lot of information and is updated monthly. So we really recommend that you go dig through that with any questions you have, because a lot have been answered. Webinars, there's a general overview recorded on Housing Benefits 101, and on our policy page, we have a PDF version of that. We also have targeted case management webinars that were recorded and will be posted soon, that were presented in June for our targeted case managers. So there will be one for mental health, vulnerable adult developmental disability, and child welfare for youth in transition ages 18 to 21. Providers need to develop individualized transition and sustaining plans for each person they are working with. HB 101 already has a wide variety of transition-related tools that can be used to build a transition plan, and is soon to be uploaded. Keeping My Housing Plan, which, while not required, will provide a complete sustaining service plan. These are very helpful tools for an easy plan template for providers who do not already have one in place for the transition and sustaining plans. Housing Benefits 101, as I mentioned, has helpful tools for people served, including benefits lookup, budgeting pathways, and general information about housing stabilization services. There's the Vault feature, which allows for free, secure document storage and transmission, and new pro tools, including the aforementioned Keeping My Housing Plan, to guide the work of housing sustaining providers. We also have a newly developed person-served workflow, which shows a visual example of how people move on to housing stabilization services. And please reach out to the Housing Stabilization Services team anytime via email at dhshousingstabilization@state.mn.us. Thank you very much for your participation. and for the time to view our roadshow today. If you have questions, again, please contact us at DHS Housing Stabilization at state.mn.us. Thank you very much.